Hello, Alexandria. My name is Dr. Hausinger. How are you today?
I'm good. How are you?
Good. Thank you so much for coming in. And have you ever had an assessment before?
Just the assessments for therapy.
Okay, great. So you came in a little bit early and you filled out all of the paperwork. You did some screening and we'll do the assessment. And then after the assessment, we will do a UA. And the UA results come back in about a week. And then we will send this off. It looks like that we have a release of information for a CPS worker and for your primary care provider. Is that correct?
That's right.
Okay, all right. So what brings you in today?
I'm here because I'm working with CPS to make sure I can maintain custody of my daughter. She's a month old and she's the light of my life.
What is her name?
Her name is Sabrina.
Awesome. All right. How are you feeling about having the assessment done today?
Nervous. But my doctor explained it's just to make sure that I'm on the right track, that I'm doing everything I need to do to stay healthy, and that I have as many tools as I can have to make sure that I can take care of myself and Sabrina.
Awesome. All right. So anytime you need a break, please let me know. We're going to jump around a little bit in the form. And if you have any questions, please just stop me and I'll be happy to answer those. So the first thing that we're going to be doing is looking at the different dimensions. We're going to go through and get a drug use history and just see how you're doing. So this first section, I'm going to be asking about use within the past 12 months. Okay. Are you currently using any alcohol? And when was the last time you had any alcohol?
Oh, I had a drink on my 21st birthday,
What
but
was Halloween? So,
yes,
okay, good.
I
Uh,
had one drink. That was it.
okay. Well,
It's really not my thing. I don't like the taste of it.
fair enough. Okay. Let's see. Within the past year, have you used any stimulants?
Can we go over what qualifies as a stimulant just to make
Absolutely. So let's jump ahead then, and then we'll backtrack a little bit. So what we're going to do is a use history, and we'll go over each classification of drugs. And what we're looking for are patterns of when the first time you used it, if there were any breaks, any time that your use might have gone up or down a little bit. And I'm looking at it primarily in 3-year chunks. So let's say, for example, that the first time you ever had anything to drink was when you were 16 and you had one beer at a party, and then you started drinking on the weekends. I want to know what it was, if it was beer, liquor, wine, etc., anytime it went up or down in the amount. Does that make sense?
it does.
Okay, great. So I'll go through section by section. Do you remember the first time that you ever tried alcohol?
The first time I tried alcohol was at 15. My mom gave me a glass of wine at Christmas. I didn't like it. It tasted funny and it gave me a really bad headache.
Okay, all right. Were there any periods of time where you drank regularly, or with it, what you would say a pattern, like once a month or once a year, or has it been more sporadic than that?
It's been more sporadic. I just turned 21. I yeah, people offered me alcohol, but the headache's not worth it. I don't get it.
Okay, and you had one drink and you said that it gave you a headache.
The glass of wine at the first time I had it gave me a headache. I've had a beer a couple times, but that makes me sick to my stomach. And Uh, I tried whiskey on my birthday and it, blech, it just, I didn't like how it tasted.
Okay. So between 15 and 21, can you, and I know it doesn't have to be perfect, and I know lots of times we don't remember the particulars, but between 15 and 18, can you tell me what drinking looked like? If you drank regularly, or if it was once a year, or maybe not at all?
Uh, Maybe once a year.
All right. Have you ever drank to the point of intoxication?
I felt fuzzy after one drink.
Okay. I'm going to put you have no regular use of alcohol, not drinking to intoxication. Okay. So we'll move on. So the next substance that we're going to look at are amphetamines, and this would be specifically illegal amphetamines like methamphetamine, or if you've taken anything like Ritalin or Adderall that wasn't prescribed to you, or using it for recreational purposes.
Would that include meth?
Yes, yeah, it includes meth.
So the first time I tried meth was at 17. I tried it a couple of times, smoking it. And then again, not really my thing. I haven't done it since I was 19.
Okay.
Um, I used it a couple times a month.
Okay. And all the times that you used it, it was smoking. Have you ever tried it in any other format?
No, I only smoked it.
And do you know how much approximately you used? We can measure it in lines, bumps, grams, etc.
Um, it, it was mixed in with the heroin.
Okay. Okay. So we'll put amount unknown. Okay, thank you. No use past 19. Okay. 2 years. Age 19, so 2018, actually 2017. Okay, and frequency per month, 2. Thank you. Okay, how are you doing so far?
I'm okay.
Great. Okay. So next we're going to look at barbiturates. They're an older classification of psychiatric medicine. They're not used very commonly. Have you ever tried any barbiturates?
Not that I can think of.
Okay. Great. The next category is benzodiazepines. These are things like Valium, Ativan, lorazepam, Klonopin, that type of thing, the sedative drugs. Sometimes they give them to you when you have dental surgery or for anxiety. Have you ever tried any of these?
No, I've never tried any of those. Um, my dentist gave me some when I was younger and I had a bad reaction.
Okay. Do you want to put that in your medical history? So when we get there, please remind me. Actually, okay, so dental for reaction to benzo. Okay. Is that noted in your medical chart?
Yeah.
Okay. All right. Okay. Have you ever tried cocaine?
Yes. I have tried cocaine.
Okay. And do you remember how old you were the first time you tried it?
I was a little more than 16.
Okay. And do you remember how you took it?
Lines.
Okay. So nasally. Okay. All right. And first use age 16. Okay. And do you remember about how much and how often you were using at age 16?
1 or 2 lines at a time. Um, 2 weekends a month until I turn 17.
Okay. And have you used it past 17?
No.
Okay. So cocaine and meth are both examples of stimulants. These substances, for a lot of people, make them really hyper, or they're party drugs or sex drugs. But for some people, stimulants actually make them kind of evened out or calm. Okay, no use past 17. Okay. Have you ever tried any hallucinogenic substances? These are things like peyote, mescaline, LSD, DMT, magic mushrooms.
No.
Okay. Right. I'm going to skip heroin just for a second because I know it might take us a little bit more time. Have you taken any major tranquilizer drugs?
Not that I know of.
Okay. Great. Any ketamine, anything like that?
No.
Okay. All right. Have you ever used inhalants? This could be like gas, AC coolant, dust off, whiteout, paint.
Does doing my nails count?
Not unless you're intentionally doing it and sniffing the bottle on purpose.
No.
Okay. Okay.
But really, when I go in to get my nails done, whew, come out rather lightheaded.
Yes, it's quite potent. Okay, let's see. Do you use cigarettes?
No.
Okay. Have you ever tried cigarettes before?
No.
Okay. All right. Let's go up to cannabis. Have you tried cannabis before?
I tried I tried pot when I was 16. Um, I smoked a bowl or two a day up until I found out I was pregnant, and then I stopped.
Okay. So from 16 to 20, it was pretty consistent, 1 to 2 bowls a day. Okay. And
Yeah.
pot today is pretty scientific and a lot more potent than it was. So some people keep track, or they know about the percentage, or what they're using indicas or sativas. Did you track any of that information, or would you know like the concentration of what you were smoking?
I know it was higher THC,
Okay.
but what exactly, I don't remember.
Okay. Thank you. Right. In addition to smoking, have you ever tried any dabs or edibles or anything like that? It comes in a lot of formats these days.
Um, I tried a couple of the CBD ointments. I hurt my back and have a pinched nerve. I'm trying to stay away from the narcotic painkillers now that I've got Sabrina.
Very good. And CBD itself is not psychoactive. However, in Washington State, if you were to buy a CBD product in a recreational shop, by law, it has to have at least 2 milligrams of THC in it. So, however, the caveat to that is they do have CBD only stores where it's just pure CBD. And the difference is that pure CBD comes from the hemp plant. So if you are concerned about THC, especially because you are working with CPS and your physician, make sure that you're buying your CBD. They even have it at Fred Meyer's. You can get lotions and bath things like that, or a store that just sells CBD. Don't buy CBD from a marijuana recreational shop.
Okay, I will double check all of the labels when I get home.
Okay, good, because we wouldn't want you to not know that there was something in the substance and then that come up in a UA that you didn't even know about.
Thank you.
Absolutely. Okay. Let's see. So let's see. So how old did you say your daughter was? A month old?
Yeah, she's a month old.
Okay. So your last use was about 10 months ago.
Yeah. Oh, no, technically 11 months ago
Okay.
because, well, we all think it's 9 weeks. It's actually, or 9 months. It's actually 10 months. It's 40 weeks.
Okay, thank you. Very true.
Sorry. It's,
We do forget.
that's
Thank you.
just, I didn't know.
I think everything in the media or TV, it's always 9 months, 9 months. So yeah, thank you. Okay, let's go up to heroin. Can you tell me how old you were the first time that you tried it?
The first time I tried heroin, I was 18. Um, I smoked it, and I used it first on the weekends, um, and then started using it daily. Um, at first, 1 to 3 points a day, and then eventually up to 2 grams daily, until I was 20. As soon as I found out I was pregnant, I went to the doctor to help me stop because I didn't want it to hurt the baby.
So when you went to the doctor, what course of treatment did they give you?
Uh, Suboxone? Did I say it right?
Yes. Okay. All right. So you've been on Suboxone for approximately 11 months then.
Yes.
Okay. And how is that going for you?
Okay, but I'd like to get off of it.
Do you know your current dosage?
It is rubbed off of the bottle.
Okay. Okay. All right. Um,
Um,
does the doctor
can we?
have you on a taper? Are you slowly decreasing the dose right now?
Yeah.
Okay. Right. Okay. Okay. And that's something that we can check since we have a release of information for your doctor. We can get that, so that's perfectly fine. Okay. So with heroin, in the time that you used it, were you smoking it the whole time, or did you try other routes of administration like injection?
No, I stuck with smoking it.
Okay. Have you ever tried injection before?
No.
Okay. All right. And how fast do you think, or in what period of time did it go from weekends to daily use? Was it 2 months, 6 months, etc.?
Over 6 months, I think.
Okay. How are you doing? Still doing okay?
I'm okay. My grandma's cat's distracting me. I'm sorry.
That's okay. It's an interesting time where we are in our homes and still getting things done with fuzzy companions. Okay, so let's see. All right, so no nicotine. Um, have you ever tried any other opiates like like the pills, Vicodin, Percocet, oxycodone, OxyContin, etc.?
Vicodin and Percocet.
Okay, can you tell me how old you were? We'll start with Vicodin first.
Okay. Vicodin. I tried it when I was 16. Um, I try it with my boyfriend a couple times a week. The pills.
Do you know
Um,
milligrams of the pills that you were using at 16?
5 milligrams, and it went from a couple times a week to every day really fast.
Okay. And how many of the 5 milligram pills a day would you say that you were doing?
Um,
Estimate.
3 or 4.
Okay. Okay. Great. And how long did that last for?
Uh, just over a year.
Okay. Okay. Whoops. Okay. So when was the last time that you had any Vicodin?
Uh,
Was it age 17?
I was 17, but I was almost 18.
Okay. Great. Okay.
And that was because I had switched from Vicodin to Percocet, but couldn't get the Percocet.
Okay. When was the first time that you tried Percocet?
When I was 17.
Okay. And can you tell me about what that use looked like, please?
It started off as 10 milligrams. Quickly it escalated to 30. At first it was pills, and then I started snorting it and then smoking it.
Okay.
And I did that until I was 18.
Up to 18. Okay.
Yeah,
And
about
that
a year.
one,
What's that?
oh, I'm sorry. And is that when you switched to the heroin?
Yes,
Okay. And when was the last use of Percocet, do you think?
when I was 18.
Okay. 18. Okay. Okay. And then the Percocet from 17 to 18 was daily also?
Hmm.
Okay. And how many, when you switched to the Percocet 30, about how many pills were you smoking a day?
10 to 15.
Okay.
Like I said, I don't want to take a risk with my baby. That's why I don't want to I don't want to use painkillers again.
And you had mentioned previously that you had had a back injury.
Hmm.
Okay. Would you be potentially interested in discussing alternative pain management strategies?
Yes, please.
Okay. And I can give you a referral when we're done for a pain management clinic that we trust. And there are other things that you can potentially do as well, such as massage, acupuncture, physical therapy, swimming, yoga, that type of thing, in conjunction with CBD. That can be very effective. So when we're looking at drug treatment or medical treatment at all, it's just like if you wanted to go to the gym and lift weights and change and get ripped. If you go to the gym, you're going to have some results, but if you go to the gym and eat right and sleep well, then you're going to have better results. So we approach treatment of all types in the same manner.
I like that.
Okay, thank you. Great. So you had mentioned earlier that you haven't tried any of the sedative hypnotics.
Mm-mm.
Okay. All right. Have you ever tried PCP?
No. I hear people do crazy stuff on PCP.
Yes. These are kind of the stories where people think that they have wings and they'll jump out of the window or that type of thing. Okay. And so you are on Suboxone right now, and we're gonna get the medical record to see what dose you were on. So you started that at age 20?
Yes.
Okay. And are you doing the pill format, or are you doing the sublingual strip, like the Listerine strip that you put on your tongue?
The strip.
Okay. Let's see what my code is. Well, it's oral, but we're going to put sublingual. Okay. And how has the experience on Suboxone been?
Mm, I mean, there are side effects, but it's better than being on heroin.
Yeah.
So, like I said, I'd like to get off of it.
Okay.
I'd like to be healthy for Sabrina. Um,
Sorry, vicious cat. Okay, discovered. All right, so you're currently started a taper. Okay, and we'll get that dose. Okay, are you taking anything over the counter right now, like Benadryl, Tylenol, Advil, ibuprofen?
multivitamins,
Okay,
just a general daily multivitamin. The doctor said that that would help, especially to make sure it had uh, vitamin D in it.
okay. All right, and when did you start taking the vitamin regularly?
Um, I was taking a prenatal while I was pregnant, and now I'm just taking a regular daily one. So after that first appointment, that first doctor's appointment when I found out I was pregnant,
Okay. Okay. And besides this Suboxone, are there any prescription medications that you are currently taking?
mm, no.
Okay.
Well, allergy medication, but
Okay.
the doctor's monitoring that too, just to make sure.
Okay. Can you tell me the name of that medication?
Right now, he has me on Flonase.
Okay. Do you know the dose?
Um, I'd have to look.
Okay.
It's one spray per nostril once a day.
Okay.
And that's only for 3 months while the pollen's running really high.
Okay. And when did you start taking that regularly?
Oh, beginning of May.
Okay. Okay. All right. So that is the use history. So we're going to go back up to the top here. And I find that that can take a lot of time, so I like to do that first, and then we'll just continue to go through. Okay, so you haven't used alcohol, so there's no way that you're in alcohol withdrawal. Same thing with stimulants, and there's no nicotine use. Okay. Within the past year, so before you found out that you were pregnant and before you were on the Suboxone, did you have periods of time where you experienced withdrawal from opiates?
Yeah, the first couple months were rough, even with the Suboxone.
Okay.
The doctor said it probably would be because I was also dealing with pregnancy hormones.
Okay. Okay. All right. Um, right. But right now, that you've been doing pretty well on the Suboxone and haven't been experiencing withdrawal symptoms.
Not right now.
Okay. I'm just going to write this in here. Do you have an approximate date or month the last time that you had withdrawal symptoms?
Sabrina's a month old. It's June 11 months ago would have been July. So,
Okay. Right.
September-ish, maybe October.
Okay, so it's been a while. Okay, so but nothing current. Okay. All right. One thing that we didn't talk about was caffeine use. What is your caffeine intake like?
Well, I'm trying to stay away from caffeine, but I do have a cup of coffee every now and then.
Okay. And when you stop using caffeine regularly, do you have withdrawal symptoms? Like, do you feel jittery or anxious or headache?
I did at first until I realized what I needed to do was just drink some extra water, and that made the headache that it didn't make the headache go away. It prevented me from getting a headache.
Okay. Right.
It it's more a coffee makes me feel warm and fuzzy, and it's more a comfort thing than I have to have this.
Okay.
Though that may change when Sabrina starts teething and stays up all night.
Quite true. Quite true. Have you ever been to a detox facility for withdrawal from substances before?
No.
Okay. All right. And you said that you have experienced withdrawals before from heroin. Okay. And let's see. Have you used substances to alleviate or avoid the withdrawals in the past?
Mm. Gum. Um, this is weird, but my grandma gardens, and she would have me chew on mint leaves to help with the nausea I was getting and the headaches. So,
Okay.
sometimes I'll do that.
Okay. When you were using heroin and you started to go into withdrawals, would you try to find more heroin or use pills if you could find them to stop withdrawals from heroin?
At first,
All right.
but once I got on the Suboxone, no.
Okay. Okay. All right. Um, so from your use history, it didn't look like you previously had breaks before while you were using until you found out that you were pregnant. Is that correct?
That's right.
Okay. Um, so one of the things, and we would hope that the Suboxone and the relationship with Sabrina and all the other supportive factors in your life would help you to not go back to heroin. But one thing that I do want to mention is because you are on Suboxone and because you haven't used heroin in a long time, that if you went back up to the 2 to 3 grams a day, you could very well overdose and die because you don't have that in your system anymore. So if you did decide to go back to using at some point, you wouldn't want to start off with 2 to 3 grams. You would want to go to the points. And I'm only saying this out of harm reduction. So one of the things, one of the most risky times for someone that's been using heroin is when they go to detox and it's out of their system, or if they've been sober for a while and then they go back to using the amount that they were using when they left off. And that's how a lot of people accidentally overdose and die. So I just wanted you to be aware of that and how tolerance works. Do you have any questions about that?
Mm, but it's scary, and I don't want my little girl to grow up without me. I don't want to go back to using heroin.
And the only reason I bring that up is just because it is very scary and it can be very dangerous, and people do forget that they haven't had it in their system in a long time. So, okay, so you're currently on the OTP, so you're not at a risk for withdrawal right now, and you're under the care of a doctor. Okay. All right. Let's see. Okay. I put is currently on OTP management program. I will put your dose in here when we verify that. Currently on supervised taper. Last date of use, date of use for heroin. Do you know the exact date that you found out that you were pregnant and your last use date of heroin?
July 3rd was when I found out I was pregnant, and the last time I used was July 2nd.
Okay. Great. Okay. All right. Let's see. Okay. Coordinate care with PCP. Okay, great. Thank you. So this next section, I'm just going to ask you if you've had these medical conditions, and if you have, if they are treated or untreated. Okay. Anemia or blood disorder.
I've gotten really anemic during my periods in the past.
Okay. Is that something that you sought treatment for, or do you treat it yourself?
The doctor at the time told me I needed to take an iron supplement for like a week when I'm on my period.
Has that been helpful?
Not really. And the
Okay.
constipation sucks.
Okay. Diet can sometimes help there. Blueberries and almonds can help.
Really?
Yes.
Awesome.
Okay. And also cooking in a cast iron pan, a cast iron skillet, or using cast iron, you will get some of those minerals, and that helps with anemia as well.
Okay. Grandma has a lot of cast iron.
Okay. Great. So some things like that that we don't initially think of that are really easy to do, just cooking your breakfast or your dinner in cast iron, and you can get that hopefully without the side effects of the iron supplement. Okay, have you ever had rheumatic or scarlet fever?
No.
Chest pains?
No.
Fainting spells?
Only from the anemia.
Okay, all right. And how was that treated or untreated?
Um, Untreated, I guess.
Okay.
I mean, I didn't go to the doctor or the hospital for it.
Okay. Do you know when the last time that happened was?
When I was 15.
Okay, so it's been a while.
Yeah.
Kidney disease or bladder infection,
No.
liver disease, hepatitis or jaundice,
No.
cancer,
No.
diabetes,
Nope.
high or low blood sugar.
No.
Back to the diabetes. Did you have gestational diabetes when you were pregnant?
There was one spike, but they redid the test and everything came back normal.
Okay, great. Okay. Do you recall the last time you had a tuberculosis test?
They did a TB test at my second OB appointment.
Okay.
So end of August last year.
And I'm assuming it came back negative.
Negative.
Okay, great. All right. Any history of ulcers or stomach pain?
No.
Epilepsy?
Nope.
Heart trouble?
No.
Shortness of breath?
Allergies?
Okay. And you mentioned that that's being treated with Flonase.
Yes.
Okay. High or low blood pressure?
Low blood pressure.
Okay. And how is that being treated?
Uh, right now, the doctor's saying as long as I'm not passing out, he's okay with it.
Okay. Any history of head injury?
Well, try not to laugh too much, but I got attacked by an owl.
How does that happen? I'm very curious. I promise I will try not to laugh too much.
Well, I was walking to work at the beginning of December last year, and you know how dark it is around here. It was before the sun came up, and I was walking across one of the bridges, and there were trees on the side of the ravine, and an owl flew across in front of me. I'd never seen one in the city before. It was kind of like, oh wow, an owl! It's gonna be the best day ever. So cool. About 10 steps later, boom, on the back of my head.
Oh,
Yeah, it was like getting hit in the back of the head by a 15 to 20-pound feathered bowling ball. And one of my friends was studying to be a masseuse. She came over later in the week and gave me a massage because my neck really hurt. She said, yeah, you have whiplash from getting hit in the head by an owl.
wow.
Right? So, yes,
Okay.
I do have a recent head injury from an owl attack.
That is the most unique head injury story I think I've ever heard. Did
I,
it draw blood?
it did. I had a couple scratches on the top of my head.
Wow. That doesn't happen to everybody every day.
No, no, it doesn't. But you want to know what's really weird? I got curious, so I started researching. I couldn't find any statistics. I called Fish and Game, and they said, oh, yeah, it happens like once or twice a week is how often we get calls.
They're that casual about it?
Yeah, just like, oh, yeah, it's totally a thing.
Do you have to get some type of vaccination or anything like that because of the talons?
No, and that's part of why I called them. And they said, no, owls are very clean birds. They don't tend to carry disease.
Wow. Okay. I learned something new. Very unique. Okay. Do you have a history of glaucoma?
No,
Okay. Any disabilities?
no,
Okay. And you had mentioned that you've got allergies. Do you have any food or drug allergies?
I'm allergic to sulfa.
Okay. Okay. I'm gonna put treated, even that's something that you just kind of avoid and make sure it's documented. Okay, so physical injury, whiplash from owl attack. Okay. Any history of sexually transmitted infections?
No,
Okay, all right. And okay, let's see, you have one children. Okay. Have you had any history of miscarriage in the past?
no.
All right. Okay. Have these or any other medical conditions been impacted by your drug use in the past?
Not that I can think of.
Okay. Have you ever used a substance even knowing that it made a medical condition worse?
Excuse me. No.
Okay. Um, let's see, outside of pregnancy, have you ever been hospitalized?
I broke my arm when I was 15. Um, they kept me overnight for that because I went into shock.
Okay. Do you remember which hospital that was?
St. Mary's,
Okay. In what town?
Walla Walla.
Okay. Okay. And so that was 6 years ago. So 2014. Okay. All right. Have you had any medical or dental conditions resulting or being impacted by alcohol or drug use?
No,
And sounds like you do have access to medical care and you see your doctor fairly regularly, and it sounds like you have a good relationship with them.
yes, they've been really good.
Awesome. Okay, so you're currently seeing the doctor for OTP and postnatal care. Right. Let's see. And what is your physician's name?
Uh, Dr. Sylvia.
Okay. And what city? Oh, did I spell that correctly, Dr. Sylvia?
Yeah, yeah. I was gonna say she just has me call her by her first name. She likes to be more informal.
Okay. Um, do you know her last name?
Silverstein.
Dr. Sylvia Silverstein. Okay. And what city is she in?
She's here in Tacoma.
Okay. All right. Are you experiencing any medical or dental problems that need attention?
Mm, I could use a little bit of dental work, but I have to wait until my dental kicks in at work.
Okay. Do you know what you need to have done dental wise?
Some cavities filled, and I think I need to get a bridge replaced.
Okay. Okay. So, do you have a dentist that you see?
I did, but he just retired.
Okay. So the reason I'm bringing this up to you is for a couple of reasons. So because you have had a history of opiate addiction that in the past, it would make you more vulnerable to that again. And so it might be in your best interest to openly explain that to your dentist so that they don't inadvertently prescribe you something that could be harmful to you, and also that you are on OTP and are currently postnatal. Are you breastfeeding?
Yes.
Okay. Okay. And that's something that we would want to communicate um, as well. Sometimes, sometimes providers don't always talk to each other, or maybe files aren't read as thoroughly, and we wouldn't want a situation where you're given something that is triggering or does more damage. There are different things that they can do, like nitrous and ibuprofen, and things like arnica, which is a natural pain reliever. It's related to aspirin. It's actually very good for dental pain. So just again, another thing that you want to be aware of with your medical history. And
Okay.
doctors and dentists are under a lot of scrutiny these days. Washington State has a prescription monitoring program. So anytime they write a prescription for a controlled substance, it goes into a database. And if they're over prescribing, the state could come in and take their license.
I've also asked my pharmacist to put a note in my file that if any of these kind of drugs, any kind of painkillers do get prescribed and I accidentally turn it in without realizing it or it's faxed in, that they please reach out to my primary care to verify that this is okay.
Okay, very smart, very smart. Okay, let's see. So back to this, you did regularly have prenatal care.
Yes.
Okay, good. All right, so we had CPS and Dr. Silverstein. Okay. Okay. And is Dr. Silverstein an OBGYN or a PCP that does the OB, or your primary care provider?
No, Dr. Silverstein is the one who did the pregnancy test and helped me get on the Suboxone.
Okay.
My OB is is Dr. Cleary.
Okay. OB/GYN. Okay. What is Sabrina's birthday?
Sabrina's birthday was Memorial Day.
Okay. So
5/24?
5/24. Okay.
I know, I should remember that better, but the whole day was kind of a haze.
Absolutely. Do you remember when your most recent postnatal OBG appointment was?
Um, it was 2 weeks ago on, today is the 23rd, so the 9th.
Okay. 609. Okay. Right. Okay, so Sabrina's still a month old. Okay, so she probably hasn't had vaccinations yet. Um,
No.
okay.
So yeah, we are not leaving the house. We are doing televisits with her doctor as much as possible, but we're going to have to go in next week for her first checkup.
Okay. Okay. All right. So we are taking Suboxone and Dr. Silverstein. We'll check that dose. Okay. Let's see. So currently it looks like everything is being treated or managed very well, and you don't have any outstanding medical concerns. Is that correct?
Both Dr. Cleary and Dr. Sylvia are watching me for postpartum depression.
Okay.
They said that's always a risk for any mom, but with my history, they want to make doubly sure that I stay on track
Okay.
and that if there is any warning signs that we have early intervention.
Okay. How would you describe your current physical health?
Pretty good. I mean, I'm a little sore because of I hurt my back, but
Oh, that's right. Okay. Let's see. So we do have something that uh,
yeah,
might need to be looked at. Okay, where are we? Let's see. And can you tell me again how you hurt your back?
I was being silly and tried to bring all of the groceries and Sabrina into the house in one trip.
Okay. Okay. Let's see. And have you spoken to your doctor about your back injury yet?
No, not yet.
Okay. That might be something to bring up in the next appointment. Because those things have a tendency to get worse if they're not they're looked at, and it could be um, something that you could treat with massage or something like that. You had mentioned that you have a massage therapist that you have a good relationship with, so or even chiropractor, and they do have special tables and accommodations for postnatal women. So that might be something to look at too, because again, that could be a potential trigger for pain. And one of the other things is people that have had opiate use in the past sometimes can have an elevated sense of pain. And I don't know if you've experienced this. So especially if you have an injury, one of the things that can happen, especially when you stop using opiates, is if somebody hugs you or touches you, it could feel like burning or pins, or like you have an exaggerated experience with pain. So that's something that we would want to look at as well, and maybe consider some of those natural and alternative methods that I mentioned earlier, just because you would be more vulnerable to experiencing that phenomenon.
I haven't had that yet, but they did say it could happen as we're weaning off the Suboxone.
Okay. Okay. All right. Let's see. Okay. Mhm. Okay. I'm going to put you at, let's see. AR, solid relationships with medical team and currently under supervision, postpartum, is aware of potential for pain and vulnerability. So I'm going to put here follow up with PCP for pain and discuss pain management options and alternatives.
I like the idea of going to yoga. That would be really good.
Great. Okay. And there's also, since we're in a pandemic, there's a lot of free yoga classes, and there's a website I like called Do Yoga With Me, and you can actually pick pre or postnatal classes. You can pick the intensity, the length of time, the style of yoga. So there are things that you can do too from home if it's difficult to get out of the house with an infant, and also because of the pandemic situation.
Oh, I like that. I'll look into that. Thank you.
You're welcome. And I will write down that resource for you too on your paperwork today so that you have that.
Thank you, because my brain is Swiss cheese.
I understand. Okay, so we're moving right along. This next section is about emotional and behavioral conditions, and this is the section where I do ask a lot of really personal questions. So if you need a break, please do let me know, and answer as honestly as you feel comfortable.
Okay.
In the past, has anyone ever physically harmed you?
No.
Okay. Have you ever experienced non-suicidal self-injury, like where you might have cut or carved on your body before, or burnt yourself?
No.
Okay. Okay. Can you share with me, when you were a child or as an adult, if anyone has ever taken advantage of you sexually against your will? Okay. All right. Have you ever been the survivor of mental or emotional abuse?
Not that I'm aware of. I
Okay.
mean,
Okay. How is your relationship with Sabrina's father?
I want him to be part of Sabrina's life. He's a really good guy. I mean, he's got some problems, but he's a good guy. I wish everyone else could see that.
And when you say he has problems, could you elaborate a little bit more if you're comfortable?
I mean, yeah, he uses drugs, but I did too. I got off of them. I'm trying to get off the Suboxone too. I mean, I want to be there for Sabrina.
Is he currently still using substances?
Yeah.
Okay. So are there, since CPS is involved currently, are there restrictions on visitation or him being around you and Sabrina at this point?
They don't want him around her because he's using.
Okay. We'll talk a little bit more about this with your support systems a little bit in a little while. Okay, so you do have children. All right, so currently CPS involved. Okay, all right. So it sounds like because you were involved with CPS throughout your pregnancy, that you've maintained custody of Sabrina in the month that you've had her. Is that correct?
Yes.
Okay.
I'm meeting with my social worker right now, video chatting with her once a week. Natalie's awesome. She's been really, really helpful with making sure that I have the support I need. She's the one who introduced me to Dr. Cleary because I had no idea where to find an OB. She's amazing. She really is.
That's really refreshing to hear because ideally the relationship with CPS would be positive and collaborative. So it's really great that you're able to have that relationship with your social worker and receive the resources and assistance.
I mean, don't get me wrong. She doesn't cut me any slack.
They
She,
usually,
she she wants me to put in the work and she expects me to put in the work. But she's there to help me, not to make things harder. So I appreciate that about
great. Okay. This next question says, what feelings did you experience if you were labeled or if you ever felt that you were a bad parent due to chemical behavior? Have you had those types of feelings during the time that you were pregnant?
it. I did. And I was embarrassed. I was ashamed. That's not the kind of parent I want Sabrina to know me as. I want her to be proud of me as her mom.
Thank you. Describe to me if you've ever felt discriminated against or exploited as a result of your cultural heritage, gender, sexual orientation, physical appearance, or age. That's a lot. There's a lot in there.
Yeah, I get the usual catcalling and, oh, you wouldn't understand, you're just a girl, but
Okay. All right. Okay. Can you tell me if there was a time where your drug use ever caused problems for yourself or for others? So basically, a time where it was negative.
um, my friends don't want me around when I'm using. I mean, they'd love to hear from me now that I'm not. I bet.
Okay. Thank you. All right. Have there been significant losses in your life that have caused stress, like you had mentioned loss of friends due to use, or things along that type of line?
Um, I used to be in dance and music. I know this is a little out of the box, but I was a belly dancer.
Oh, is that something that you would like to return to?
Yeah, I kind of would,
Okay.
especially now that I have a belly.
All right. Um, have you had any educational limitations that you have felt that has impacted your ability to succeed in the past?
Um,
Like dyslexia, ADD, ADHD, etc.
no,
Okay. All right. Are you currently feeling any of the following: hopelessness,
no.
preoccupation with death,
Only if I watch the news.
fair enough, moodiness,
A little bit.
okay, that's probably related to the postnatal hormones,
And that's what the doctor said.
feeling withdrawn,
A little bit. I mean, we're trying to avoid people. So,
okay. Do you feel, are you experiencing sleeplessness?
mm, I've adjusted my sleep schedule to match Sabrina's as much as possible. And I can usually fall asleep fairly quickly.
Okay. Are you taking unnecessary risks?
I don't think so.
Okay. Are you
Oh,
feeling self-destructive?
no.
Okay. Decreased energy?
I have a newborn, so yeah.
Yes. And are you giving away valued possessions?
No.
Okay. 8. This next question, I just like to preface this with: everybody thinks about suicide or death, and there's a phenomenon called the call of the void, where you might be driving your car and you get a split second, like, what would happen if I drove my car over the ledge? But you're not actually intending to do that. It's just a psychological phenomenon. So it's okay to think about death and mortality and all of that, and a lot of people do, especially when they bring life into the world. So that's, this question isn't asking about that. It's more of a suicide screening, like if you're currently thinking about suicide, your relationship to the concept of suicide. But I like to just preface that because sometimes people are nervous about asking this question, but it's perfectly normal and natural and healthy as a person to think about mortality and all that type of thing. So that being said, what are your current thoughts about suicide?
It's really the last thing on my mind. I've got so much to live for. I've got this beautiful little girl.
Okay. All right. Do you have any history of suicide attempts in your family?
Um, in my adopted family, no. I don't know about my biological family. It was a closed adoption when I was a baby.
Okay. The reason that we ask this question is that statistically, if there is a suicide in the family, then there is an increased risk and incident of other suicides in the family, especially if a parent completes suicide, then their adult children might be more likely to attempt and complete. And also, if a sibling was to attempt and complete, then their siblings might be more apt to do that. So that's the reason why we asked this question.
So almost like it's almost like the addiction where if one family member is or was addicted, you have a higher possibility of becoming addicted.
Yes, there are certain factors in there as well. A lot of scientists believe that genetic and biological factors are about 50%. And the reason that we get that number is if we look at twin studies, identical twins, if one identical twin has an addiction, the other identical twin is probably, they say maybe like 8 or 9 times out of 10 likely to have an addiction. But with fraternal twins, it's 50-50. And so that's where those numbers come from. But suicide risk factors and substance use risk factors are almost identical, and they are risk factors for each other.
Okay.
Okay.
Interesting.
Have you ever attempted suicide in the past?
No.
Okay. Do you currently have a plan to self-harm?
No.
Okay. All right. I'm going to put you at a very low risk for suicide as evidenced by your statements. Okay. All right. Okay. This next section we're going to ask, have you ever had thoughts of hurting others? And this isn't referring to things like road rage or, you know, annoying people on the internet that you feel like slapping. It's not like that. It's actually like intentional. I have a plan to hurt somebody, that type of thing.
No, I haven't. I mean, logically speaking, they're not worth that much time in jail.
Very smart. It seems like you have very solid impulse control.
I'm learning.
Do you have any history of combative, violent, or assaultive behavior?
No.
Okay. All right. Have you ever driven a motor vehicle after consuming mind-altering substances like alcohol or heroin?
No.
Okay. So in the time that you were using heroin, you weren't driving?
I had my driver's license, but my grandma did something really smart. She had me ride with a tow truck driver on a busy holiday weekend, and after hearing the police say, "Hey, make sure your ride along stays in the truck. We haven't found the head yet," it made an impression.
Wow. Okay. Okay.
A drunk driver hit the back of a car before, and it was one of those old trailers that didn't, old semi-trailers that didn't have the drop-down guard.
Mm-hmm.
The truck shoved the car underneath, and it decapitated the driver.
Wow. Okay. Right. So it sounds like although heroin was a really big part of your life, you were able to, this is called harm reduction, you were able to make sure that you weren't driving. Okay. Your grandma sounds like a really smart lady.
Yeah, she is. She's pretty awesome.
Have you ever done anything while under the influence of alcohol or other drugs that you later regretted? Fights, sometimes people do things if they're unable to work, like steal or sell themselves to get their substances or that type of things. A lot of people do things that they normally wouldn't do if they're not using drugs under the influence.
My adopted mom left me this really beautiful locket. It didn't have a picture in it, just engraved initials, and I, I pawned it for drug money. I've always regretted that.
Is that something that you think you would be able to get back?
I tried, but I haven't been able to find it. Um,
Thank you for sharing that. I know it is really difficult sometimes to go back and look at those things. One of the things that sometimes keeps people in active addiction is the shame and guilt that they feel, especially if they've wronged others. But the reality is those people have forgiven you a long time before you've forgiven yourself. And forgiving yourself is really what helps you move forward from an addiction.
Well, I'm also seeing a therapist right now, and she said if I don't talk about this stuff, it's never going to get better. So I'm trying.
Very good. So we'll want to get a release of information for your therapist, if that's okay too, to help coordinate care, because a lot of these things, if we do determine that treatment would be helpful for you, those two things can help inform each other.
Okay.
Okay. So this question, so even your drug use has been within the past year. So when we're looking at an assessment, we're looking at use within the past year, and you're almost at that mark where you're in full remission, which is great. So you have about a month and a half or 2 months where we would consider you in remission. So right now you're in early to medium remission from heroin, but at your year mark, we would consider you to be in full remission a year post, which is great. So this question's probably for, within the later part of the last year. How much time did you spend on average in a typical week in activities necessary to find your drug, use it, and recover from it? So for example, getting money to get it and then using it and then recovering from it and then finding it again, that type of thing. Sometimes it's actually a full-time job. So if you can, we kind of like to tally up those hours and see about how many hours a week you think that you were dedicated to your substance.
Well, my boyfriend always got the drugs.
Okay. So from 18 to 20, since you were using every day, was that essentially what your full-time job was, or were you able to work or go to school during that time?
I was still going to school. I couldn't study as much.
Okay. So if you had to put a number on it, since you were using daily, because you also kind of want to think about like how many hours a day were you high, and then how many hours a day was the crash, and that type of thing. If you had to give a number on it, what do you think that number would be?
2 to 3 hours a day.
Okay. I'm going to think that maybe that's a conservative estimate, and it might have been a little bit more because of the amount that you were using. And the reason I'm saying that is, opiates are downers, and so we might not have a very clear picture of a time frame, if that makes sense.
I was sleeping a lot more.
Okay. All right. And you said that there were times where you had given up your friend group, and then you had been pursuing music and dancing, and then that might be something that you would like to do again.
Yeah.
Okay. Mm. And how do you feel about that now that you had arranged your life to accommodate the substance use instead of things that brought you joy?
Looking back, it seems like kind of a dumb thing to do.
Thank you. Okay. Um, so I know you're 21, but there, sometimes with the internet, gambling has become more accessible. So this is about gambling. In the last 12 months, have there been periods of time when you needed to gamble with increasing amounts of money?
No,
Okay. Right. Do you gamble? I probably should have asked that first.
no.
Okay. All right. So this is NA. Okay. Um, let's see. Have you continued to use alcohol or other substances despite having identified problems that were made worse? So, for example, a really common thing is when people are diagnosed as bipolar, they might continue to drink alcohol and not realize that the alcohol is making their disorder worse. So the question is asking if you've ever had a diagnosis like depression or anything like that, and then continued to use substances, then it actually could have made it worse.
Um, no. They're like I said, they're keeping an eye on me for the postpartum depression,
Okay.
but I haven't been diagnosed with depression or anything like that before.
Okay.
And other than that, all I really know, well, the anemia and allergies. Not not that I can think of.
Okay. Have you ever been diagnosed with a cognitive disorder like ADD or ADHD or anything like that?
Um, prego brain. I've,
Yes, but I'm not going to put that down because it's not a formal diagnosis. Um, but I do understand. Um, all right. Do you
no,
have any difficulty understanding written materials in English?
no,
Okay. Let's see. Do you need any assistance to understand written or verbal information?
no.
Okay. Let's see. So I'm going to ask you about mental health conditions or complications that were not related to your substance use. So periods of time where you might have felt these on your own. So have you had a significant period of time that was not a direct result of substance use where you felt anxious or nervous?
Right now,
Okay,
pandemic related. Um,
absolutely.
my doctor said that's normal, and it sounds like situational anxiety, but we will keep an eye on it to make sure it doesn't become chronic.
Okay, great. Inability to comprehend.
No,
Okay. Eating disorders,
no,
hallucinations,
nope.
grief or loss issues.
And the doctor did say that the anxiety I'm dealing with could be related to grief, that they're seeing a lot of grief type symptoms right now.
That makes sense. Depression,
A little bummed. Um, Again, keeping an eye on postpartum.
sleep disturbances. Okay. Phobias, paranoias, or delusions.
I don't think so.
Okay. Hostility or violence.
No.
Loss of appetite.
Um, Morning sickness when I was pregnant, but that was it.
Okay. Okay. You had mentioned that you were adopted, so you're unsure of the medical history. Is there any mental illness in your adoptive family?
No,
Okay. Have you ever been diagnosed with a mental health disorder?
no.
All right. And you said, yes, you are receiving mental health counseling. Do you know the name of your current provider?
Uh, she goes, her name is, again, I'm on a first name basis with so many of these doctors. It's kind of cool. Uh, Dr. Samantha Thomas.
Okay, all right. And so we'll get a release of information for that. Okay. Have you ever been or currently prescribed medications for mental health?
No,
Okay. Are you currently taking any drugs that are not prescribed to you?
no.
All right. And how would you describe your current mental health?
I would say average.
Okay. All right. So we're not here because of BAC. Okay. Let's see. Okay. Good. I'm going to summarize that you're experiencing mild to moderate grief and anxiety, most likely due to the pandemic. Okay. Um, Continue mental health therapy and monitoring the PCP. Okay. So we are moving right along. We're getting closer towards the end. These are kind of long, so I do appreciate you staying with it. So this next section is going to talk about treatment history and kind of your motivation for being here. Have you ever attended treatment before? Okay.
No.
Okay. All right. And you had said that this was um, partly because you're working with the physician, and then also CPS had wanted you to get a referral or an assessment done to see where you were at. Is that correct?
Yes.
Okay. All right. And I'm also going to say that you're self-motivated because you've mentioned that a couple of times, that it's important for you to be sober and to be a present mother to Sabrina. Okay. All right. Do you believe that you currently have a problem with drugs or alcohol?
Yes, it's something I'm working on resolving.
Okay. And do you believe that you've had a problem in the past?
Yes.
Okay. Have you ever felt that you should cut down your use or control your use of substance?
At the time, no, but looking back, yeah, it was kind of out of control.
Okay. Um, Prior to finding out that you were pregnant, had you ever tried to cut down by yourself or control how much you were using, or maybe put rules around it, like I'm only going to use on this day or afternoon, or like anything like that?
Yeah, I'd only use I only used when I was with my boyfriend. I didn't when I was with my family or when I was with my friends.
Okay, thank you. About how many times do you think that you tried to quit on your own before going to see your doctor?
Um, I don't know, 4 or 5.
Thank you. And what is, before this period of sobriety and opiate treatment, what's the longest that you went without using since you had started?
Probably a month.
Okay. Okay. Great. Has anyone in your life in the past expressed a concern about your drug use?
My friends, my family.
Did you have any, the word intervention just means like tool or technique. It's not necessarily referring to the TV show where, you know, people sit you down and read letters. Um, did you have any interventions or any people coming forward or anything that was like, okay, stop, or that type of thing, ultimatums, etc.?
My friends said if I kept seeing my boyfriend that they didn't want me around, that they didn't like how I am with him because of the drugs.
Okay. Right. And I'm also going to put pregnancy here because that was a big motivating factor in stopping. Okay. So if you had to describe your use of drugs, what would you say?
When I was using or now?
Both.
Um, when I was using, I would have said it's just for fun. Now I would say it was kind of a problem.
Okay. Okay. Let's see. All right. Okay. So you're not court ordered to be here. Okay. And you're not under the supervision of the Department of Corrections.
No,
Okay. Have you ever been arrested or charged with any crime?
no,
Okay. Okay. You've never been in jail or prison before?
no,
Okay. So if it was really easy, would you like to quit using?
yes.
Right. At the moment, how important is it for you that you stop using? So most important, about as other important, not important.
It's the second most important thing in my life.
Okay.
The
I-
most important is Sabrina.
Okay. I'm going to put that in the summary. Okay. How seriously would you like to reduce or quit drinking altogether? Not at all. Probably yes. Definitely yes.
I really don't drink.
Okay. So we'll just put drug use then. So how seriously would you like to reduce or quit drug use altogether? Not at all. Probably yes. Definitely yes.
Definitely yes. And the only thing I'm on is the Suboxone.
Right.
And okay,
So these are worded a little strangely, especially because you've had almost a year sober. And the purpose of these questions are to see where you are in the stage of change. But you've already made these commitments. So it is a little funky, the wording, it's a little bit awkward, but we're just gonna try to get your actual intention. Um,
okay.
okay. So for example, this one, do you intend to reduce or quit drinking in the next 2 weeks? You could say no because you haven't used in almost, a year, and so it's not quite applicable.
But I don't intend to drink either.
Right, right, right. Um, let's see. Okay. And this one's worded a little funky too. What is the possibility that 12 months from now you will have a problem with drugs? Definitely not, probably will, definitely will.
Definitely not. I do not want to have a problem with drugs or alcohol in a year.
Okay. Okay, let's see. All right. Okay, so this is what we had done in the beginning, which is the use history. So we are almost done. We're getting towards the end. I know that this is kind of a lengthy process. Okay, and you had said that you had tried to stop about 4 to 5 times previously, and that the longest you were able to go without it was a month. Okay. And during those times, what was your motivation to stop using?
My boyfriend wasn't around. I only use when I'm around him.
Okay.
Not only used, since I'm not using anymore.
Are you concerned that if you were to see him regularly, that you might be tempted to start using again?
And I'm hoping he'll get clean.
And what if he doesn't? Or it's not on the time schedule that you would prefer?
I don't know. I mean, I want him to be part of Sabrina's life, but I, I don't know. It's
Okay. Actually, I made a mistake here. This is talking just about alcohol, and we don't have alcohol, so I'm just going to move these answers down. Okay. Okay. So in the period of time where you had stopped using, um, you had said that your boyfriend had come back.
yeah, we would go on family trips, or he he would he wouldn't be around, and so I wouldn't use.
Okay. How would it make you feel when you started using again after your periods of abstinence?
I felt pretty shitty, honestly. I, I, I shouldn't say that, but it's the truth.
Why do you feel like you shouldn't say that?
You're a doctor. I'm not supposed to swear around you.
I don't know who told you that. I hear a lot of stuff every day, so please don't feel the need to censor yourself.
Well, my grandma would be absolutely horrified at that kind of language.
I can understand that. Okay. Have you experienced cravings to use drugs?
Not since I got on the Suboxone.
Okay. But in the past when you were on
In
it.
in the past, yeah.
Okay. Okay. Didn't spell that correctly. Okay. Right. All right. Okay. Well, it seems like for this period of time, which is almost a year, in addition to being on the Suboxone, what has helped you maintain your abstinence?
Sabrina,
Okay.
I want to be healthy. I want to be a good mom for her. And I can't do that if I'm high, if I'm trying to get drugs. If
Okay. Okay. So in the time that you've had Sabrina, where has her father been? It sounds like he's not really allowed to be around. So I'm just kind of curious, what that relationship looks like right now.
So I did let him see her. I mean, he's her dad.
And how did that go?
All he talked about was wanting to go get high, and so I left. I took her and we went to the park instead.
That sounds like that was hard
It was. I mean,
and disappointing.
he doesn't understand why I'm trying to do this.
Mm-hmm. Mm-hmm. Are you prepared to make boundaries with him if he decides not to be a part of her life, or if he decides not to stop using?
I mean, he loves me and I love him, and we're supposed to be there for the people we love, right?
Sometimes it can be harmful to yourself, you know, when people are in different stages. And so you can love someone, but what being there looks like might be different. It might not mean physically being there if it puts you at risk of using, or if it puts you at risk of losing custody of your daughter. So that's maybe something to think about in terms of, are there ways that you can be supportive and loving from a distance that would still allow you to maintain your sobriety and take care of Sabrina?
I'm gonna have to think about that.
It's definitely not easy. It's definitely not something that, you know, you magically come to. So, okay. Let's see. All right. Okay. Mm-hmm.
I mean, I know I can't get high with Sabrina around. Anything could happen, and I can't risk that with her. That also means I can't risk having him around while he's high.
Very true.
So, but at the same time, he's her dad, and I know he loves us.
This might be, if you're not, but this might be another thing to speak to your therapist about as well, in terms of relationships and boundaries, and you know, how to protect you and Sabrina also emotionally, because, you know, as you know, it can be really difficult now that you're sober. It can be difficult from that other side to see somebody go through an active addiction, somebody that you love. It's very different than going through an addiction yourself, where you're on that other side of the mirror, so to speak. And that's something that we can help you with as well.
Yeah, something to think about and talk about.
Another thing, and I don't know if Natalie, your social worker, has talked to you about this too, is having a parenting plan in place, which is a legal document that is filed with the court. And it's very common in these situations too, since it sounds like you have full custody right now. And what it would do is it would prevent things like, I hate to say it, but like kidnappings or custody disputes. And it would also set the groundwork that, you know, if you wanted him to be involved in her life, like, he would have to perhaps submit to UAs and do parenting classes and treatment and that type of thing. And it's a legal way of protecting yourself and Sabrina.
I think I want to talk to Natalie about that. That sounds like a good idea.
And you may or may not need to use it, but it's there to protect you and your daughter from, is, you know, we would like to hope that he would like to be clean and be a part of your and Sabrina's life in a healthy way. But if that wasn't to happen, then this would be a solid document that you would have that's filed, and then you would have legal backing to protect yourself.
Like Grandma says, when all else fails, CYA with red tape.
I like it, Grandma.
I think he'd like you too.
We are almost done. We are so close. You've done such a great job. I know this does take a couple hours to do. So this is the last part of the assessment. And then we'll make sure that we have the releases of information and do UA. So in the past year, what has your employment situation been like?
I'm working in an auto body shop as the secretary, the receptionist. They were able to transition my job to work from home for the pandemic, which was really cool. I'm doing all of the phones and paperwork ordering, and they're starting to have me do some of the accounts receivable
Okay.
remotely too.
All right. So it sounds like a really positive and accommodating situation, and it's probably really helpful to be working from home with a newborn.
Yeah, it really is.
Okay. All right. Are you receiving any type of public assistance as well, like food stamps or anything like that?
They have me on WIC right now.
Okay. Great. Do you know that you can use your WIC at the farmers markets? You can buy fresh produce, and you can also buy seeds and things to grow your own food.
I didn't know about the seeds, but I knew about the farmer's market.
Great.
I thought that was really, really cool.
They're really doing these programs to expand, and also during a pandemic, it's not a bad idea to grow your own food so that you can, if there are shortages in the food supply.
I'll talk to Grandma. She'll know what we can grow and what we have room for.
Right. In the past, which of the following employment problems, if any, have you experienced due to drug or alcohol use? Have you ever been late for work?
I was late to school. I
Okay.
think that would count.
Yes. All right. Um, okay. Diminished productivity?
I would say yeah, because I wasn't studying as much. All of my drug use was before I got my job.
Okay. Okay. Great. Absenteeism from school?
Yeah,
Okay. And I think you mentioned that you had left school and then gotten your GED. Is that correct?
yeah.
Okay. Okay. So longer term picture, what do you see yourself doing for school or work?
Well, I'd like to go back to school and get my degree in accounting.
Okay.
I'd, I'd kind of like to be a forensic accountant.
That's interesting. What does a forensic accountant do?
A forensic accountant goes in and looks at the books to find fraud.
Okay. Interesting. Are there programs around this area where you can do that?
I could go for accounting at UW. I have to look deeper to find the forensic accounting. And my internship, I'd probably have to move,
Okay.
which is kind of scary.
It is, especially during a pandemic, but this sounds like maybe it's something that's within the next 5 years, and hopefully within that time things are stabilized in the country, and a year can make all the difference. So
Yeah. I mean, yeah.
okay. Do you currently identify with any organized religion?
No, not organized.
Could you elaborate?
I'm pagan.
You can say that a little louder.
I'm pagan,
Okay.
and my my family is Baptist, but they raised me to believe that finding my own path is the best thing, and they're very supportive of this, of me finding what's right for me, not doing what they do because it's tradition.
Okay. So would you say that you consider yourself to be a spiritual person?
Yes.
And what does that look like in your day-to-day life?
Um, it means when I need to talk to the gods, I light a candle and I respect nature. Um, I don't take more than I need. Um,
All right.
that, that's what it means to me.
Thank you. Is it unusual for you to talk about your path with other people?
Most people don't understand and it can be kind of judgy.
Okay. Um, Thank you. Do you identify with any particular cultural, ethnic background or community?
Not really. Um, they suspect I might be part Native American, but they're not 100% sure, and I haven't had the DNA testing done.
Okay. If you were to do that, the tribal services, I know the Puyallup Reservation does this. They have genealogists and people that could potentially help you figure that out. And then if you are of a certain percentage, register for a tribe. And that might be something to look into because you could receive resources like medical and help to go back to school and even housing allowances as well. So that might be a longer term goal to look at too if you're comfortable doing that.
And that could really help Sabrina.
It could. It could, and you. Absolutely. Um, okay. Okay. Let's see. Do you see any cultural considerations or barriers to treatment or recovery?
We as a society are very judgmental.
Very true. How does that figure into potential treatment or recovery for you?
It makes it harder to admit that I have a problem and ask for help.
It does sound like, and especially medical communities can maybe be on the judgy side, but it sounds like you have a really good team that is positive and encouraging and helpful.
They are now. We had some bumps. We we had a couple knockdown screaming matches at first. But we got to a point where they understood that I was serious and I want to do what's right for Sabrina. Even before I knew she was Sabrina.
Are there any barriers that you see to accessing treatment?
Waved hand wildly at outside world.
Have you ever been involved with a self-support group, a self-help group before?
Um, I lurk in a couple of Facebook groups. Does that count?
Yeah, there's a lot now, especially online, and a lot of these have moved online for pandemic. They have 12-step meetings, and some people really like 12-step. Other people don't care as much for 12-step because it is based in Judeo-Christian tradition, and there is a patriarchal element there. But there are a lot of other alternatives that people like. There is a native path called White Bison, the Red Road to Wellbriety, and they have kind of adapted 12-step around the medicine wheel and a spiritual component. And they have meetings in a newsletter. They also do sweat lodges. There's Smart Recovery, which is based in cognitive behavioral psychology. And a lot of people like it. They describe it as free therapy. And they also have family meetings there too. And they do it on the phone, and they do it via online, like Zoom and Skype type thing. And there are women's only meetings. There aren't any current meetings that I'm aware of for pagans, but there are books written by pagans in recovery, and I can give you a reading list as well if that would be something that you're interested in.
Yes,
So
please.
when we hear sober support groups, a lot of people automatically think of 12-step because they've been around for the longest, but there are a lot of other options out there, and I encourage everybody to try different groups to see what they like.
I'd also like to hear more about the the native approach, and maybe next time we talk.
Absolutely, absolutely. Okay. All right. So what are the Facebook groups that you lurk in? What are those orientations?
Uh, One of them is the 12-step approach, and it's kind of preachy. And one, I think it would be under the cognitive based, because it it talks. I have to use the dictionary, and I Google a lot of words, um, and they're all psychiatry, psychological type words.
Okay.
And what they say makes sense, but sometimes it's hard to apply.
Absolutely. Okay. Okay. Let me scroll up here for a moment, and we are so close to being finished. Okay, so and I know that you're unsure of your biological family. In your adopted family, is there any history of chemical dependence? No.
No,
And it sounds like your family is very supportive of your abstinence.
very supportive.
Okay. So you live with your grandmother, but do you have regular communication with your parents?
Uh, they live in they live in Snohomish County, but my job is down here,
Okay.
and so I moved in with Grandma and Grandpa. Uh, Grandpa isn't doing quite as well right now. He's he's struggling a bit.
Okay. Great. So you said that your family is very supportive and that your friends are supportive when you are not using and if you're not with Sabrina's father. How does Sabrina's father feel about you being abstinent and sober right now?
He he doesn't understand why I'm so judgy.
Okay. Mhm. And would you say that your living arrangements are supportive?
Yeah, I love living here with Grandma. Um, she she makes sure that I get enough sleep, and I know that's why I'm not as sleep deprived as a lot of new moms, because she gets up early. She literally gets up with the crows, or with the not the crows, the rooster.
Oh, wow.
And so she gets up with Sabrina first thing in the morning, and has so I can sleep in a little bit longer. And then I stay up with Sabrina later at night so that Grandma can sleep.
That sounds like a good balance.
It's great.
Great. And you do have your job. It sounds like housing is good too. So would you say that you have your basic needs financially taken care of?
Yeah, Grandma and I collaborate to make sure everything's taken care of. She's really teaching me how to budget and um like right now she's got me paying all of the household bills and showing me how to manage money for long-term things like buying a car, buying a house, planning for retirement, um, she has me looking at the Social Security projections on when that's going to run out and what whether or not there will be money for when I retire and how to plan around that. Really kind of cool.
Wow, that is very good planning. Good. Okay. All right. Okay. Let's see. Okay. Let's see. So family, supportive family, and employment.
Mom and Dad are excited to meet Sabrina as soon as it's safe to. They've gotten to Zoom with her, but
Oh,
but
good.
they're both essential workers and they didn't want to take the risk of bringing anything down.
Okay. And it is a very interesting time that we are being in right now. So it'll be all the more sweeter when you can make that that visit happen.
Yeah.
Okay. All right. Okay. Let's see. So what I'm doing is I'm looking at your substance use for the past year, and we're almost at that year mark. So you are in remission right now, but then we'll consider you to be at full remission at the 12-month mark. So when we look at this, the diagnosis is for the past calendar year. Okay. 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 So, no use. And you said the last time that you used was
Uh,
July.
July 2nd.
July 2nd. All right, so we're almost hitting the year mark. Okay, so let's see. 2, 3, 4, 5, 6. All right. So we would have said that you did have a fairly severe heroin problem. Okay. Let's see. Let's see. Okay. Good. All right. So we are on OTP. All right. Okay. All right. So you are almost in a year remission, which is a fantastic milestone. You have a really strong support system right now in terms of of your medical doctor, your OBGYN, and your therapist. You have not previously had any drug treatment in the past. And so if you are open to it, I'm wondering if you would be open to looking at some outpatient-based treatments, specifically for drug education skills. We help with boundaries and understanding the root of using and why you were using, and kind of where you're at now. And it could be a helpful support system for you too, if that is something that you're interested in doing on an outpatient basis.
So I'd still be able to take care of Sabrina and be there for her?
Absolutely. So we're not talking about inpatient. I think that it could be helpful for you to take some outpatient classes. Intensive outpatient would look like 3 days a week, and you would be doing this on Skype, so you wouldn't even have to leave your home, and one-on-ones would be like this too. So you would have group 3 times a week for about 2 hours, and then a one-on-one like this once a week, or once a month, sorry. So group every week 3 times, and then a one-on-one once a month. And then you would have the sober support meetings or self-help meetings. Because you are in therapy, usually we ask people to do 2, like an AA or a Red Road meeting. But because you are in therapy, we can count one of those meetings to that. So you have such a really good support structure right now. The other option would be kind of, and I'm not actually sure, I don't necessarily think that you would need to go 3 days a week. I think maybe twice a week for a couple months, and then down once a week. And again, you wouldn't have to leave your house. So basically it would be a custom treatment program for you. It wouldn't be necessarily the intensive outpatient, which is usually 3 times a week for 2-hour groups for 3 months. I would probably recommend twice a week for a couple months, and then down to once a week. Just for, it's a psychoeducation based program. And statistically, so what I mentioned earlier, it's very helpful if you're trying to work out, that you eat well and get good sleep and go to the gym. This is kind of the same thing. It's a wraparound approach. Since you are doing prenatal care and you do have therapy, this could be something that could augment what you're doing. But also there's a spectrum of intervention, prevention, etc. And having some of the knowledge and the skills that we teach in outpatient, I think would help to prevent future use.
Yeah, I'd be open to that. I think
Okay,
it sounds like a good idea.
great. Great. Other things that we also do talk about in treatment are codependency and helpful relationships and hurtful relationships, and a parenting component that I think would be helpful as well. So what I would like to do, and the treatment plans are something that are fluid. It's not set in stone, so we can always adjust it. So I would like to maybe see you do twice a week for about 3 months, and then maybe once a week for about 3 months or so, and then see where we go for there. Is that something that you would be agreeable to?
Yeah, I'd have to work with my schedule with my boss, but
And we do have, most people that are in outpatient do work full time. So we have meetings that are in the morning, and we have meetings that are in the evening. And then as far as self-help group meetings online, they have them from 6 a.m. to midnight every day and in different time zones. So one of the things that's been maybe a blessing in disguise, so to speak, with the pandemic is that it's been helpful for us to see that there's different ways of doing treatment that might be easier for people, especially if they have anxiety or newborns and it's difficult to come in and out. This type of interface, a lot of people feel more comfortable in a group setting like this, less judged, and that type of thing. So that's what I'm going to recommend. I'm going to recommend 3 months of 2 times a week group. This is the IOP group. A lot of people in IOP go 3 times a week. I'm thinking that because of the other supports that you have, twice a week would be enough. Followed by 3 months or 12 weeks of 1 time a week. And when you get to the weeklies, that's 90 minutes instead of 2 hours. One on, one a month. We will do random UAs, but that's something that CPS likes to do as well. And I know that you've been doing that with the OTP program anyways. So it really isn't any different than what you would be doing. Okay. And then my other question is, with your CPS involvement, have you been taking any parenting classes, or is that part of the plan at this point?
I requested to take parenting classes.
Okay. Great. Okay.
Because putting a diaper on a squirming baby is a whole lot different than putting a diaper on a 10-pound bag of flour.
Yes. Yes. All right. Okay, so we're going to do 1.0. It's kind of in between intensive outpatient and outpatient. So, okay. All right, so we will get those releases of information. And it takes about a week to get the UA back. So once your UA comes back, I will finish typing up your assessment, and then we will go from there. And I'll send that in to your doctor and to Natalie, that everybody knows the plan. And then what we can do now, if you'd like, if you want to do treatment here, we can certainly do that. If you wanted to shop around for different treatment centers, you could do that as well. But whenever you're ready, we can schedule an intake and get you scheduled for group.
Okay. I'd like to do it here.
Okay, 8. All right, 8. Okay. Well, I thank you so much for your time, and you probably have to go to the bathroom now, so we'll go ahead and do the UA, and after that, we'll bring you down to the front desk, and we'll sign you up for an intake, and then they'll assign you to a group that matches your schedule and what you need to do, and then we will just go from there. And if there is an instance where you have to miss a group, then it's really easy to make up a group, especially now with the Zoom and the interface.
Okay.
All right. Well, thank you so much for your time, and we will be in touch.
Sounds great. Thank you.